Welcome to another episode from the Veterinary Medicine Digest. Today, we're diving into a fascinating and often challenging condition in our canine companions, extrahepatic portosystemic shunts, or EHPSS. For years, the general understanding has been that these congenital shunts, which are abnormal blood vessels bypassing the liver, are primarily seen in smaller breed dogs like the Yorkshire Terrier, the Havanese, and the Maltese. In fact, it's been widely documented that small breed dogs have a 93% chance of having an extrahepatic shunt if a shunt is present, while large breed dogs typically present with intrahepatic shunts. But what about those larger dogs? The available information has been surprisingly sparse, leaving many clinicians in a state of uncertainty when these cases arise. That's where a groundbreaking new study published in Veterinary Surgery titled Clinical Presentation and Short-Term Outcome of Dogs Greater than 15 kilograms with Extrahepatic Portosystemic Shunts comes in. This multi-center retrospective study draws data from 10 university hospitals and one private referral institution aimed to shed light on the demographics, clinical presentation, shunt anatomy, and short-term outcomes for these larger dogs, specifically those weighing 15 kilograms or more. So who were these dogs? The study included 63 dogs with a median weight of 22.3 kilograms and a median age just under 2 years at 21.9 months. Interestingly, this age range is quite similar to what we typically see in both small breeds with EHPSS and large breeds with intrahepatic shunt cases. The most commonly represented breed in this case was the Golden Retriever, making up nearly 29% of cases. The other breeds included Labrador Retrievers, German Shepherds, and a diverse mix of others. When these large dogs presented to veterinary specialists, their clinical signs were strikingly similar to those seen in their smaller counterparts. The most frequent issues included lethargy in almost 62% of dogs, neurologic abnormalities such as ataxia, obtundation, and circling behaviors in nearly half of the cases, and seizures were documented in over 20% of dogs. Polyuria and polydipsia, or increased urination and thirst, in 46% of dogs, and vomiting and/or diarrhea in about 35%. Beyond clinical signs, the blood work painted a picture consistent with compromised liver function. A large majority of dogs, almost 89%, showed decreased albumin levels, a key protein produced by the liver. Other common findings included low protein, low blood urea nitrogen or BUN, and low cholesterol. On the flip side, liver enzymes like alkaline phosphatase or ALP and alanine aminotransferase or ALT were elevated in over half of the dogs, indicating liver stress. Elevated ammonia levels, a toxic byproduct the liver usually processes, were also elevated in 60% of the dogs tested, and pre- and post-prandial bile acids were elevated in all tested cases. It's also worth noting that over a third of these dogs were anemic. Before considering surgery, most dogs received initial medical management aimed at reducing toxic waste products like ammonia. This typically involved lactulose, antibiotics, and a liver-specific diet, with anticonvulsants added for seizure control as needed. Now let's talk about the shunts themselves. Diagnostics primarily involved ultrasonography and CT angiogram, often used in combination to map out the complex anatomy. The most common shunt configurations observed were splenocaval and portocaval shunts, each accounting for about 25% of cases. Interestingly, the study also found some less common types, like splenophrenic and splenoazygous shunts, which are not typically seen in small breed EHPSS dogs, and could indicate unusual anatomical variations in these breeds. Another significant finding from the imaging reports was portal vein hypoplasia, noted in over half of the cases where portal system anatomy was described. This is an area that does warrant further research. Of the 63 dogs, 45 ultimately underwent surgical attenuation for their shunt. The most common methods used were cellophane banding and amyloid constrictors, both designed for gradual occlusion of the shunt. It's important to note that attenuation was aborted in 3 dogs due to signs of portal hypertension, a dangerous increase in pressure within the portal vein system that could occur if the liver can't handle the sudden increase in blood flow. Many of these surgeries also included concurrent procedures with cystotomies for bladder stone removal, with ammonia urate stones being a common finding, and liver biopsies, which consistently showed signs of hepatic hypoperfusion or reduced blood flow to the liver. So what are the outcomes for these surgically managed dogs? The good news is that surgical management of EHPSS in large dogs showed similar short-term outcomes to those in small breeds. Short-term complications such as vomiting, diarrhea, and lethargy occurred in about 38% of surgically treated dogs. Critically, the shunt-related mortality rate for surgical management was just under 7%. This is comparable to, and in some cases even lower than, the 2 to 27% mortality rates reported for surgically treated small breed dogs in established literature. Revision surgeries were performed in a small number of dogs for the 45 due to persistent clinical signs indicating the complexity of some cases. A significant positive outcome of surgical attenuation was the ability to reduce or even discontinue medical management. At the 90-day follow-up, 37.5% of surviving attenuated dogs were completely weaned off medications, and another 15% were maintained only on a liver-specific diet. This stands in stark contrast to the medically managed group, where all dogs remained on their original shunt-related medication regimens. And speaking of the medically managed dogs, the 18 dogs who did not undergo surgery, 22% experienced documented shunt-related deaths within the follow-up period. While limited by the smaller sample size, the study's Kaplan-Meier survival analysis showed a clear difference in long-term survival. Surgically attenuated dogs had a survival rate of 89% at 1 year and 77% at both 7 and 5 years. In contrast, medically managed dogs had an 82% survival rate at 1 year, and it dropped off significantly to 49% at 2 years and only 24% at 5 years. This really highlights the benefit of surgical intervention for long-term prognosis in these large breed dogs. In conclusion, this study provides critical insights for large dogs with EHPSS, the extrahepatic portosystemic shunts. It confirms that their clinical presentation and short-term surgical outcomes are comparable to the more commonly reported small breed dogs. Surgical attenuation is a viable and effective treatment option for large breed dogs with extrahepatic portosystemic shunts, leading to fewer shunt-associated deaths and a greater chance of reducing or eliminating the need for lifelong medical management. While the study acknowledged limitations such as lack of standardized imaging protocols and the challenge of retrospective data collecting, its findings offer valuable guidance for clinicians and owners facing these complex cases. The similarities found between large and small extrahepatic portosystemic shunt dogs can help guide surgical case selection and better inform client expectations. That is it for this study. Thank you for listening to the Veterinary Medicine Digest. The title for the reference paper is in the video description. And remember to test your knowledge by answering the questions in the description. And as always, keep those minds inspired, hearts light, and tails wagging.